Today we are in Sokolumi, which is part of Pandebele, Kwankosi Mahlangu, and we are doing the same that we do every day, saving lives and giving rural communities an opportunity to have the services that we always provide to the cities. So we do have our cancer screenings, our COVID screenings, Home Affairs, SASSA, NDA, and the total health package. And the intention is really to spread the message, early detection saves lives, but to also give people in the community an opportunity to receive that which they would have spent money to go in their own communities.
The reason why I'm here today is to support the government in its drive to fight ailments like HIV, cancer, but more importantly today we're faced with COVID-19, the coronavirus that has caused major problems not only in this community but also in the province, in the country and worldwide. And we're putting our hands together with partners like Social Development, with partners like the Pink Drive, to make sure that people are tested and pick up these ailments early enough so that they may be addressed and attended to. So it is our purpose of being here today to make sure that the government fights the coronavirus with everything it has.
This is Pink Drive's 5th year of working with the Rand Water Foundation, and we are eternally grateful for the funding that they have provided us to offer COVID screening and testing in the communities of South Africa. Today we are at CWJ community in Soweto, and as you can see we have screened a number of community members and sent them for testing for COVID.
It is very helpful for us as the community because this is the first time it's happening in our community. So we really appreciate all the partners that are here, Home Affairs, SANEC, Rand Water, we really appreciate.
Today I think we are truly humbled by Pink Drive together with all the other partners that are here, because we've set up a one-stop shop for many activities that Social Development Department is providing. We've had a few incidents of COVID-19, so this will come in handy to have this done. Screening and testing for mammograms for women is vital because if this doesn't come here, there is no way that community members will be able to have this facility. It takes a long time for you to get your results or to be on the waiting list to do your pap smear as well as your breast cancer screening. It's an important day for Sokolumi. I think we value it, and we believe that we need to have this as frequently as possible because it serves the community a lot. I think when we talk about Batupele, when we talk about service delivery, this ranks amongst one of the best programs that Social Development has brought to Sokolumi.
Today we are happy that this partnership, we're going to do a lot of screening. We're not only screening women, but only the men also for prostate. In the midst of COVID, we shouldn't actually forget other chronic illnesses that we've been struggling with as a country, or TB. We thank for this partnership because as a community outreach where we couldn't reach the people as a facility, this event is going to assist us to reach people that we can't reach. And if you are hungry, actually, you can't think of going to the clinic and do the screening and the testing. So Social Development is assisting us in that context.
Pink Drive campaign is one of obviously the campaigns that we always support, because we also do know that as part of the non-communicable diseases, breast cancer is obviously one of the diseases that we need to know their status about so that we can take the necessary treatment. So we are basically saying we encourage our people to come on board and be able to test to know their status, and because if they do that, they will be able to solve some other problems that might actually be bigger in the future.
Literally overnight, at the start of COVID, we had to change our services. We immediately offered our medical team to the National Department of Health to start and assist with COVID testing and screening. And if it wasn't for an organization such as Rand Water, who came forward and provided us with funding, we wouldn't be where we are today. Tragically, over the past 3 months, we were not allowed to do cancer screening, yet cancer didn't stop when COVID started. Our partners today have been Department of Social Development, Department of Health, SASSA, Home Affairs, who have provided all the additional services that we've seen here. The numbers have been overwhelming as always, and we've probably reached over 500 people. And having a health activation service such as ours not only makes it easier for the community, but I think most importantly allows them to know what their status is rather than having to wait for weeks, maybe sometimes even months, to find out whether they've got a disease or not.